Hello and welcome to our presentation. Today, we'll be discussing Medicare, the different parts and aspects, as well as how one might supplement their Medicare benefits. My name is Tim Pfeiffer, and today I'll share important information from Nevin and Witt Insurance Services. They've served consumers and seniors across the country for more than 65 years and counting. Nevin and Witt has served tens of thousands of beneficiaries since Medicare opened its doors in 1966. Today's presentation will take approximately 30 minutes. We hope you'll find it to be very educational. If at any time you would like to contact us, please call us at 1-800-247-9889 or email help@medicareexpert.com. Thank you and enjoy the presentation. Medicare can really be a maze. There are many different moving parts to this federal program. We'll be going over all those parts and giving you a good idea of how to find your way through this maze. What is Medicare? Medicare is a social insurance program established in 1965. Medicare provides health coverage to almost 50 million people aged 65 and older and to people who are disabled. Most people on Medicare have aged into it. Some people end up on Medicare because of a disability, such as permanent kidney failure. However, the majority of Medicare recipients aged into the program at 65. Individuals should apply 3 months prior to turning age 65. We recommend applying no less than 2 months before your birthday. Therefore, if your 65th birthday is in 2 months, it's time to get the ball rolling. Applying for Medicare, as mentioned, you'll want to apply 2 to 3 months before the month during which you turn 65. You do not have to be retired to apply for Medicare, and you can contact Social Security Administration. We've put the national number on our slide, 1-800-722-1213. Now, enrollment should be automatic if you're already receiving Social Security or railroad retirement benefits, but most of you probably are not drawing on Social Security yet, so within 2 months of your 65th birthday, you'll definitely want to call them. Medicare has 4 parts to it. I realize that our slide is showing 3 parts, but we'll get into all 4 parts. Part A of Medicare is your hospital insurance. Part B is medical insurance. Part D is prescription drug benefit, and Part C is the managed care aspect to Medicare. Coverage basics start with Part A of Medicare. It covers such things as inpatient hospital care, skilled nursing care, some home health care, and hospice care. Part A is the facility fee for when you're in the hospital. It does not cover the doctor, surgeon, or the anesthesiologist. It covers the room and board of your stay. The majority of your claims are probably going to fall under Part B. A statistic once noted, more than 80% or so of all claims fall under Part B of Medicare. You can see why that might be the case based on how broad the coverage is under Part B. Part B covers doctor's services and outpatient care, preventive services, diagnostic tests, some therapies, and durable medical equipment. Now, keep in mind that neither Part A nor Part B of Medicare is full coverage, which is why people will get policies to supplement their Medicare. Here at Nevin and Witt, we can certainly help you with that if you choose. Part D of Medicare is the prescription drug benefit. Co-payments and deductibles will be your responsibility. A good Medicare supplement will help cover these expenses, but if you don't have that type of secondary coverage, these costs are your responsibilities. For example, a Part A deductible is due by you for each benefit period, which is 60 days. Therefore, it could come up more than once per year, and you need to be aware of this. Should you find yourself in the hospital for more than 60 consecutive days, you have a co-payment due for each day you're in the hospital, beginning with the 61st day. If you find yourself in the hospital for longer than 90 consecutive days, you have an even larger co-payment for each day thereafter. A good secondary insurance will help you pay for these expenses. If you find yourself needing a skilled nursing facility care, you'll have a copayment as shown here for days 21 to 100. Medicare pays 100% of the first 20 days in skilled nursing care. If you need blood, the first 3 pints of blood will be your responsibility unless you have a good secondary coverage. Part B of Medicare is where you might possibly have some very large expenses. There are parts of your medical bill that Medicare will pay, but a decent percentage of the bill will end up your responsibility. This is where a good secondary coverage would help you tremendously. As mentioned, Part B covers such things like doctor services, outpatient care, preventive services, diagnostic tests, some therapies, and durable medical equipment. Doctor services received while in the hospital and during all outpatient services are covered. So what is not covered? To start with, you'll have the annual Medicare Part B deductible shown on the screen. It's not a huge amount, but still a cost for you. The second part is the one to pay attention to. Many people think that Medicare pays 80% of the doctor bill. It does not. Medicare pays 80% of what it approves as payment to the doctor. Therefore, you, the consumer, will need to pay the other 20% of the approved amount, as well as 100% of the unapproved or excess charges, unless you have a good secondary coverage. The prescription drug plan, or Part D, is an outpatient prescription drug benefit that is offered and operated by private insurance companies. The federal government subsidizes the plans. So, in other words, you buy or sign up for your prescription drug benefits through companies like Blue Cross, Blue Shield, AARP, Silver Script, Humana, etc. Plans may vary substantially, covering different drugs and charging their own co-payments and premiums. However, they must be comparable to the standard coverage. When the government designed the prescription drug benefit, they came up with a base benefit that all plans have to stick to, and each private plan builds upon that benefit base, choosing their own covered drugs, co-payment amounts, and more. At Nevin and Witt, we'll help you with your prescription drug questions. Again, if you give us permission to talk to you, we can give you some great ideas on which Part D plans may work best for you. Medicare also has a terrific tool on their website. It's www.medicare.gov. Again, that's www.medicare.gov. You can see that I have it here on my slide. You can put in the prescriptions that you're taking, and it will tell you what the best Part D plan is for you in your state. You can also call 1-800-MEDICARE. The other advice I would give you is to ask your pharmacist. If you have a working relationship with your pharmacist, I highly recommend that you talk to them. They have terrific insight and advice on which way to go as far as prescription drug plans are concerned. As mentioned, there are a few different options for supplementing your Medicare. In addition to Medicare supplements, there are Medicare Advantage plans, which we'll talk about later. You may also have group insurance options in place that will supplement your basic Medicare. Purchasing a supplemental policy is smart, and here's why. Medicare has deductibles and co-payments that have a history of increasing annually. As these amounts change each year, a supplement will also change to pay those costs for you. The gaps in your coverage will disappear. Medicare will cover less than half of your total charges, but a good supplement will cover these costs. In 2007, the Centers for Medicare and Medicaid Services estimated that Medicare out-of-pocket expenses averaged roughly to $3,800 for a single person and $7,600 for a couple. Your expenses could be more or less. Let's take a look at the benefits of purchasing a Medicare supplement plan. As we mentioned, Medicare supplements close the gaps left in your basic coverage by deductibles and co-payments. They're also guaranteed renewable for life. You cannot be canceled from your supplement. Now, obviously, if you do not pay your premiums or if you falsified your application, that's a different situation. Other than that, no matter how high your current medical expenses may be, you cannot and will not be declined or canceled from your coverage. One of the main reasons that people buy a Medicare supplement, besides full coverage, is the ability to use any doctor and any hospital in the country that takes Medicare. No referrals are necessary. This is worth emphasizing. California, Colorado, New York City, it doesn't matter where you are, whether you live there or are traveling there. A good Medicare supplement will allow you to go to any doctor and any hospital in the country that takes Medicare. This is a very important point when looking for coverage. Private insurance companies sell Medicare supplements. They're lettered A to N. As you go down the list, the coverage changes. Nevin and Witt will recommend you consider an F plan. That's F as in Frank. It provides full coverage after Medicare pays its portion. There will be no deductibles and no co-payments for you to pay. Medicare would be your primary coverage, and remembering that Medicare has some gaps in it, an F plan will pay the balance for you in full. Whether you buy your supplement through Nevin and Witt or somebody else, consider the F plan. The F plan is the way to go. As mentioned earlier, you have the freedom to choose your doctors and hospitals. In addition, these are not HMOs or managed care plans. F plan equals full coverage and freedom. This chart here shows all the plans that are available to you. Again, we highly recommend that you consider the F plan. You can see that it is very broad coverage. Here, we have some points to keep in mind when considering a Medicare supplement purchase. Freedom to use the doctors and hospitals of your choice. We hammer home this point because we know how important it is that you be able to keep your doctor if you choose. With a good Medicare supplement, you won't have to worry about losing your current care providers. Claims-free billing. This is an important point. The insurance providers that we recommend have no paperwork for you to fill out, and you don't need to file anything with anybody. The paperwork for medical claims can be a huge headache, so this is a big plus. Guaranteed renewable for life. You cannot be canceled from your coverage as long as you pay your premium and do not falsify your application with omissions or misstatements. No balance billing with an F plan. 100% coverage with Medicare. Probably the very first time in your life you'd have 100% coverage, meaning no co-payments, no deductibles, no anything. No pre-existing waiting periods, in most cases, if you're dealing with any existing medical condition. Care provided for these conditions is paid from day one. Therefore, the very first day your policy is effective, your existing conditions will be covered, again, in most cases. These policies also have no annual or lifetime maximum benefit limits, so you cannot run out of coverage. Here are a few things that you want to keep in mind when looking at different insurance companies. Premiums are a factor. Remember, the federal government standardizes Medicare supplements. This means that coverages are the same from company to company. For instance, if one company charges $150 a month and another company charges $180 a month for the same coverage, then premiums are a deciding factor. What plans do they offer? This is also an important consideration. Definitely look around at your options. You'll find most companies are offering the F plan. Again, take a look at the F plan. It's top-of-the-line coverage. We also have options with a plan called the High Deductible F plan that helps reduce premiums. Ask us about it. Customer service. Is the company notorious for having great customer service, good customer service, or poor customer service? Ask your family. Ask your friends. What have you heard? What have your friends told you? Those are important factors in your decision. What is the brand? Is it a brand name? Is it the no-name insurance company? Or is it a company you've heard of before? If no-name insurance company is $5 a month less, but you've never heard of them, is it worthwhile to take the risk for a couple of dollars? I would consider whether it's a good idea to do business with them or not. Value-added benefits. What else can you get for your money? The bottom line is you're spending your hard-earned money. What else are you getting for it? Are you getting discounts on vision? Are you getting discounts on dental? Some companies that we represent even have gym memberships included. So, what else are you getting for your money? And what value-added benefits are they offering? As long as you apply for a Medicare supplement within 6 months of going into Medicare, you cannot be declined coverage. You have a golden ticket. The golden ticket, if used wisely, will allow you to get any Medicare supplement that you want, and a request for coverage cannot be declined. You don't have to wait for your Medicare coverage to start in order to get the ball rolling on your secondary coverage. Just make sure to apply within 6 months of going into Medicare at age 65. Now, there are some other golden ticket opportunities. If you're over 65 and coming off group insurance, you have a golden ticket. If you're coming off a Medicare Advantage plan, you have a golden ticket in some cases. Use this opportunity wisely and you can't be declined for coverage. Let us talk to you. Let us discuss your situation with you. The agents at Nevin and Witt are experts in this area. We've been in business for over 65 years, helping seniors get the coverage they need. We are Medicare experts. We have many options and a lot of knowledge. So hopefully you'll let us discuss this with you. We can give you a great idea of how to use your golden ticket wisely. As mentioned, there are a couple different ways to supplement your Medicare. We've just briefly talked about the Medicare supplements. The other option is Medicare Advantage plans. What exactly is a Medicare Advantage plan? These are federally subsidized plans that you can sign up for to replace your Medicare benefits. If you sign up for a Medicare Advantage plan, a payment is made from the federal government to the insurance company. As you can see on our slide, in most cases, Medicare Advantage plans have inpatient, outpatient, and prescription drugs built in. And here's the kicker. In most cases, they have little to no premium. That's the #1 reason people get a Medicare Advantage plan, because more often than not, there is little to no premium to pay. Remember, these are federally subsidized plans. You must keep your basic Medicare benefits, but you'll not be accessing its benefits. Instead, the insurance company will provide you with all of your health care benefits. Again, a Medicare Advantage plan is an all-inclusive plan with little to no monthly premium. There are a few hoops to jump through, which we'll cover further into this presentation. So, what are the pros and cons of Medicare supplements and Medicare Advantage plans? Each has some positive points to consider, as well as some drawbacks. The next few slides will show the pros and cons of both programs. The bottom line is that we are a full-service agency, and no matter the route that you take with these plans, we can help. We have all types of solutions and options for seniors. What we want to do is educate you. We want to make sure that you know the ins and outs, the pros and cons. Only then can you make an informed decision. Whatever you decide, we're happy to be here for you and to help you out in any way we can. Let's start with the pros of Medicare supplements. First and foremost, the better plans offer full coverage. Remember we talked about how full coverage is available for doctors and hospital expenses after basic Medicare pays its portion of the covered expenses? You can see that it pays all co-payments and all deductibles, leaving you with nothing coming out of your pocket. The F plan can provide these benefits. Having a Medicare supplement plan that pays 100% after Medicare pays its portion. That's a big deal and will save a considerable amount of money. There are several advantages to purchasing a Medicare supplement. Most plans have no pre-existing waiting periods and no annual or lifetime maximum benefit limits. Most are guaranteed renewable for life, and in many cases, you are guaranteed acceptance into the plan. Remember my Willy Wonka example? Medicare supplements are completely portable, meaning that you can take them anywhere in the country as they're not tied to federal funding. You don't have to worry about the federal government making any changes that would kick you off or change your benefits, which could happen with a Medicare Advantage plan. As you might expect, Medicare supplement plans also have some disadvantages. Medicare supplements have higher monthly premiums than Medicare Advantage plans. In addition, if you want prescription drug coverage, you need to purchase it separately. If you go this route, your health care package will consist of Medicare as your primary coverage, a Medicare supplement to pay the balance of your bills, and an add-on prescription drug benefit to round out the perfect package. The people at Nevin & Witt are experts in helping you design the perfect Medicare package for your particular situation. Now, let's talk about the benefits of a Medicare Advantage plan. Most plans have little to no monthly premiums. This is the #1 reason some choose a Medicare Advantage plan. In addition, most plans have no waiting periods for pre-existing conditions and no annual or lifetime benefit maximums. Some plans have value-added benefits included, such as dental, vision, and chiropractic care, and nearly all plans include the prescription drug benefit. The Medicare Advantage plan is an all-inclusive plan. Medicare Advantage plans have a downside as well. You'll be responsible for any deductible before coverage kicks in, and you'll need to make co-payments once you meet your deductible. On a bright note, these plans do have an out-of-pocket maximum, meaning there is a limit on what you will be responsible to pay. The out-of-pocket maximum for most plans averages around $5,000 per year. In the event you endure a catastrophic medical event, your exposure could be quite substantial. Deductibles, co-payments, and uncovered excess charges all count towards this maximum. The premiums paid for your plan do not count. Another downfall is that you must use approved doctors or hospitals. You must see providers who agree to accept the plan you've chosen. Doctors can opt out of taking the plan if they choose, which means you may not be able to keep your current treatment providers. This is worth emphasizing, especially if you have a close working relationship with your physician. Medicare Advantage plans are also renewable on an annual basis and are tied to continued federal support. If at any time in the future the federal government reduced its financial support, it could have a negative effect on your policy. This issue does come up from time to time during budget discussions in Washington. What about your prescription drug options? Believe it or not, the law ties our hands when it comes to what we can tell you. The federal government does not allow us to discuss very much of this with you unless you specifically ask us about it. We know it sounds crazy, but if you want to talk about Part D or the prescription drug benefits available to you, you have to ask us. Here's what we can tell you. We make recommendations from a few specific companies. The plan we recommend most often ranges from $35 to $50 a month in premiums, depending on where you live in the country. There are no deductibles on this plan, and your copayment is $8 for most generic drugs. So again, we can't tell you the name of this plan by law, but if you ask us, we can talk about it. Coverage for costlier prescriptions is available. You can receive a 90-day supply on some of these plans with retail and mail order options included. So ask us about it. We have some great plans for you to choose from, and we can use our resources to find the best plans for you, even if we don't represent the insurance carrier. Talk to us about your particular situation, and our agents will match you up with a perfect plan for your needs. Cut my Medicare benefits? I don't think so. Some people think Medicare will soon be a thing of the past. At Nevin & Witt, we truly believe that Medicare will be around for a long time to come. Will it continue to look like what it looks like today? Probably not. I think Medicare benefits will pay less and less as time goes on, pushing more of the financial burden onto your lap. That's an even greater reason to have a secondary insurance or a group policy in place. We do not believe that Medicare will disappear. I don't think any politician is willing to touch that issue. But again, we will see a change over the years to come, making it important to have a Medicare supplement or Advantage plan if you don't already have group coverage through an employer. Do you even need Medicare coverage? Without talking to you, there's no way to know for sure. If you give us a call, we can learn more about your situation and offer some advice and options. You might have something in place already, like group insurance, Medicaid, Medi-Cal, or something else. It's important to ask yourself where your money is best spent. Nevin & Witt Insurance has worked with many people over the years who feel that sense of obligation to keep the group insurance just because they worked for their company for 20 to 30 years. We believe that such loyalty should be commended, but at the same time, you must make an objective decision about where to put your money to its best use when it comes to health care. If your group insurance premium costs $400 or more each month, it's time to switch. We have options that are less expensive and probably provide even better coverage than group insurance. Your group insurance probably has co-payments and deductibles that a good Medicare supplement plan will not. Look at the money leaving your pocket. Spend it the best way possible, making each dollar go further and do more for you. Medicare supplements can help you do this. Which insurance carrier should you choose? We represent many carriers: Blue Cross, Blue Shield, Mutual of Omaha, Humana, Aetna, and AARP. Many of these companies have been around for a long time. Mutual of Omaha, for example, has been around for over 100 years. Whether you're considering Medicare supplements, Medicare Advantage plans, or prescription drugs through Part D, we can help you. Let us walk you through the process. The insurance companies we work with offer things like fast claims processing, claims-free service, no pre-existing waiting periods in most situations, full coverage with Medicare, no deductibles, no co-payments, and the freedom to choose your own health care providers. Okay, so what now? If you're within a few months of turning 65 and are interested in getting into Medicare, we would like to talk to you. If your 65th birthday is 3 or more months away, we would still like to put some information in the mail for your review. We can then call you as your birthday gets closer. We'd love the opportunity to help you, but if we cannot provide you the best deal, we'll be honest with you and point you in the direction you should go. That's our promise to you. Nevin & Witt Insurance wants to help you with your enrollment decision. We provide outstanding customer service for the life of your policy. We're a one-stop shop when it comes to Medicare coverage. Again, we've been in business for more than 65 years, helping seniors with their Medicare needs. We get the job done right, and we'll do what it takes for 100% customer satisfaction. So, why should you do business with us? Well, I believe there's some very strong reasons to choose us as your broker. We have live people on the other end of the phone when you need to talk to us. Although the occasional call may go to voicemail, you'll not get lost in a maze of automated systems that only send you in circles. We're here to pick up your call. Our customer service agents are available to help answer any questions or help you resolve any issues with your plan. We have your back. We are your professional ally every step of the way. Here are some other reasons to choose Nevin & Witt Insurance. The best things in life are free. An insurance agent costs you nothing. Your premium is the same regardless of which company or agent you choose. Having an insurance agent at no extra charge is a no-brainer. At Nevin & Witt, we have influence. We're one of the top producing agencies in the country. That means if you have an issue with your policy, we can pick up the phone and personally talk to the vice president or other high-ranking official at the insurance company in order to get issues cleared up for you in the quickest, most efficient way possible. We have the experience to get things done. Our agents have more than 125 years of combined knowledge. I'm sure you have some wonderful agents in your area, but these are some strong reasons to do business with us instead. With an agent in a small mom-and-pop shop, you may be unable to reach someone if they're on vacation, homesick, or working irregular hours. Our agents are available Monday through Friday, 9 a.m. to 5 p.m. And with dozens of employees available to help you, we meet your customer service needs promptly and swiftly. Finally, and this may sound a little corny, but we truly care about our clients and giving them the best service possible. We want to develop a relationship with you that can grow and thrive over the years. We honestly believe that our clients deserve our care and attention. We strive to interact with each client as if he or she is part of our own family, because they are. I know this sounds cliche, but we really are here for you. I keep mentioning that we've been in business for more than 65 years. There's a good reason for that. We take extremely good care of our clients. We hope you'll let us prove that to you. In conclusion, I make these solemn promises to you. We'll only offer products that are right for your situation. We'll always do our very best to provide you the service that you deserve. Nevin & Witt can provide that for you. If we miss your call, we'll promptly return it and help you in any and every way that we can. And should any obstacles arise, we will move mountains to get around it. As you can see, there are a lot of moving parts to Medicare, and we would like to help you work through the maze of options we talked about earlier. If we can be of service, please call us at 1-800-247-9889. You can also email us at help@medicareexpert.com anytime. In addition, feel free to share this information with your friends and family. If somebody is helping you with these decisions, forward this presentation to them or have them visit medicareclass.com 24 hours a day, 7 days a week. Our goal is to educate as many seniors as possible. So if you found our presentation to be helpful, please pass it on to your loved ones. Thank you and have a wonderful day.